We've been joined via phone now by Perpetual Ofori Ampofo, President of the Ghana Registered Nurses and Midwives Association. Good evening to you, Mum. Mr. Alex Opoku-Mensah says he's sorry for disrespecting the nurse on duty for correcting his daughter's wrongful prescription. Do you accept the apology, or you still want him out of office?
Good evening to you and to all your listeners. Indeed, it wasn't an apology that we were expecting from him. Otherwise, we would have stated so in our press release. It is alleged that he has been misconducting himself in so many other ways. And we have stated in our press release that within the next 72 hours, we expect government to indeed relieve him of his duty as Regional Director in the Ashanti region for the National Service Scheme, because he's not fit to hold that public office. Looking at what transpired at the Menchia District Hospital, when you look at the medical team and the varied professionals that are in there, of course, when you look at the work that we do, some of these things are bound to happen, but there is a way of resolving it. If not between the two professionals, the nurse manager, for example, or the medical superintendent could have come in to help resolve this matter. But it wasn't for the father of this house officer to come into the health facility and verbally abuse and threaten the nurse who was just doing her job and advocating for the patients, as it were. Because the medications that had been issued in your earlier narrative, from the report that we have, it wasn't about a medication error. The point was that some medications had been prescribed as an order, and the pharmacy could not provide two of these medications, and per the e-health system that is being run, the patient was going to be billed for it. What was therefore the next line of action was for the house officer to either change those medications to something else that the pharmacy had, or to delete it from the system so that the patient was not billed for it. And that is exactly what the nurse tried to do. The fact that the house officer felt offended by the choice of words or by the tone of the nurse's voice and all of that, we were all not there and we were not privy to that information. But like I said, so far as we work in the medical team, these things happen. Every nurse or midwife will have one story or the other to tell about some encounter that he or she has had with a medical doctor or somebody else in the team. But there's always a way around it. But it is unheard of for the father of a professional to come into a hospital and verbally abuse and threaten a nurse for that matter.
So
it is wrong.
Yes. How exactly do you want this case handled? How do you want it to be handled?
We want Mr. Alex Opoku-Mensah to be sacked. He should be sacked. And we have asked our Ashanti Regional Branch to report the matter to the police. We hope that they have done so as at this time, and they are going to give us that report. Beyond that, we have also called on the management of the hospital to take the professionals through teamwork, team building, and all of that. They need it. Teamwork is very important to ensure that the patient or the client's outcome in terms of the services they are requiring from us as caregivers is the best. And for that matter, there is need for respect within the team to ensure that the patient gets the best of services from all of us. So we've called on the management of the hospital to ensure that some of these things are done. And of course, the role of the nurse in the medical team, if people don't know about it, they should be educated so that people can understand the role of the nurse in the medical team, which is very, very important. The nurse stays 24/7 by the patient and serves as an advocate and ensures that whatever needs to be done for the patient is done. If it means calling a doctor to come and see the patient or having to do whatever, or in the case of this particular nurse, changing medication or deleting it from the system, it is our responsibility to ensure that this is done for the nurse.
So what happens if your calls are not heeded to? What do you do?
We have said that within 72 hours, if Mr. Alex Opoku-Mensah is not relieved of his duty as Regional Director, Menchia District Hospital are going to lay down their tools, the nurses and midwives. Following from that, we'll escalate it to Ashanti region. All nurses and midwives in the Ashanti region in full support are going to lay down their tools. If we don't hear anything, we'll all take it up nationally, because this is an abuse not only on this nurse, but on all of us as nurses and midwives in Ghana.
Right. Perpetual Lufori is president of the Ghana Registered Nurses and Midwives Association. Thank you very much.